Hello, you're watching 12 on Health. The summer months are typically a great time for kids, but not for those who suffer from a complex brain disorder that makes their senses overly sensitive. It's called sensory processing disorder, and here to tell us more about that is Dr. Robert Reynolds from the Connecticut Educational Services in Middletown. And Dr. Reynolds, what is sensory processing disorder?
Well, sensory processing is the information we get from our senses. Our five senses are sight, hearing, smell, taste, and touch. And we take in information about the world through our senses. And the processing of that is something that needs to happen relatively smoothly in order for us to have an appropriate response to the environment. So when you have a problem with sensory processing, as in the case with children, for example, who have sensory processing disorder, it means that they're oftentimes getting flooded with too much information from their senses, almost like a neuronal traffic jam, if you can imagine that. And as a result, we see behavioral manifestations that we sometimes don't understand. For example, it's not uncommon for parents of younger children to have kids who are very picky eaters. Maybe they only want to eat mac and cheese every night, and when they don't get mac and cheese, they have a behavioral meltdown. Or maybe they don't like the tags on their clothing or the way it makes them feel, and they cry and want their tags cut off. So those are the more common ones, but not uncommonly as well, we see kids who have a difficult time processing the visual field and the auditory field as well, overwhelmed in classroom situations and meltdown in the classroom, and are disciplined and punished for that when they can't really say what's going on except that they're feeling overwhelmed. Other children will withdraw from situations because the situations are overwhelming to them.
Now, typically when a child has the disorder, is it one sense or another, or can it apply to all the senses?
Well, it can be one sense, or it can apply to many senses. For example, right now, you're looking at me and you're listening to what I have to say, and you're bringing that together in your mind. Children with sensory processing problems don't always do that so easily. It's hard for them to do both at once. And so you could be looking right at a child and thinking he's understanding what you're saying, he's not hearing a word of it because he's paying visual attention, but he's got to tune that out in order to do it.
Kind of along those lines, what are some of the symptoms that are associated with this?
Well, the symptoms run the gamut depending upon the particular child and which sensory modality is most affected. For example, children who have the proprioceptive sense most impaired, that would be their muscles and their coordination, they look clumsy, they have a hard time with handwriting, they have a difficult time interacting on the ball field. So these are children who, that's where the problem lies. Other children, when they're overwhelmed in a situation or an environment, we might see them as very withdrawn and quiet and keeping to themselves and not very social because the social environment is overwhelming to him. Other children, interestingly enough, almost overreact to sensory stimulation and they go very hyper. And these children are not uncommonly misdiagnosed with ADHD and then put on medications for a condition they don't have. So that's why it's very important when we look at a child's behavior and the challenges that they face, not to jump to conclusions about what might be causing it, but to take a closer look, because it's not uncommon that children who have sensory problems show behavioral issues that get misdiagnosed.
Now, your clinic is the Connecticut Educational Services. It's up in Middletown. You have developed a treatment for this sensory processing disorder, and we have some photos of that. Kind of explain what is the treatment and what's going on here?
Well, the treatment that we're looking at here is something called EEG neurofeedback. And it's a way to actually teach a child how to regulate their interactions and their reactions to the world and to help calm that sensory input and help them to manage it better. We do it by actually affecting the electrical activity that their brains are producing, teaching them how to bring it under better control so that they don't overreact to environmental stimulation inappropriately. It takes a little while. It's not like taking a pill. It takes about 2 or 3 months actually to get this under better control. But once that happens, their lives go on a lot more successfully. They do better in school, they're better manageable at home, and they're just in general, their self-esteem picks up because their lives are working out.
And this is another example of the same technique, correct?
Yes, there are 2 steps to it. This particular step that we're looking at here is called the quantitative EEG, or brain map. This is what we begin with, taking a picture of that electrical activity that this child's brain is producing to compare it to a database of normal children's electrical activity to see where that particular child's issues are. Once we've identified that through this quantitative EEG, or brain map, then we use the neurofeedback training, which is playing video games actually with their thoughts while these sensors are regulating or teaching them to regulate their activity.
And all of this is done without drugs.
And that's the best part.
What is that benefit there? Why is that such an important
Because this is a permanent solution. When a child is on medication, even if he has a positive response to medication and has no side effects whatsoever, as soon as he's off the medicine, he's right back to where he was. I'm more interested in teaching children the skills that they need to manage their lives better and more effectively. At my clinic, we have a saying, skills before pills. It's not that we're against the meds, but we think that other things can be just as effective, if not more so, on a permanent basis that parents need to be informed about.
And this actually is quite common.
The neurofeedback training?
No, the sensory processing disorder.
About 1 in 6 children demonstrates some kind of impairment or impediment in that area. The issue is always how much of impediment, how much does it impair their lives? And so if you find that if any of the people watching this show, they find that their children might be struggling with something like this, they should at least get an evaluation to see if this is the fact.
And is there an age range that it typically applies to? I mean, I don't want to say do kids grow out of it, but once they're beyond 12 or 13, is it not so much of an issue or that sort of thing?
Well, what happens more often than not, unfortunately, is it doesn't go away. But children learn to accommodate it. And what that means is sometimes not always good news. They might withdraw from situations, from developmental challenges. As these folks get older, if they still don't get it treated properly, they can sometimes get depressed or become anxious because their lives aren't working out and they don't know why. So there's a lot of reasons to try to catch this as soon as possible, because otherwise it can have a very negative effect on the trajectory of that child's life.
Okay, Dr. Reynolds, thank you very much. Again, the Connecticut Educational Services in Middletown, we appreciate you joining us. And coming up next on 12 on Health, the mental and physical toll of trying to find work.
You want to scream and yell and cry and, you know, just throw everything away, like, forget it.
Jobless and growing hopeless in southwestern Connecticut will have expert advice on how to re-energize your job hunt.